This is the fourth in a series of short video clips from the Adult Speech and Language Therapy Service in NHS Ayrshire and Arran, designed to support basic dysphagia care. These clips are aimed at our whole community, including people living with dysphagia, their family, friends, carers, care home staff and other professionals. Today we will be discussing IDDSI, explaining what IDDSI is and where to find the information. So, you're probably asking yourself, what does IDDSI stand for? IDDSI is the International Dysphagia Standardisation Initiative. This is a bit of a mouthful, but what it means is that we now have a framework that provides a common language and terminology for describing food textures and drink thickness, no matter what age you are, what culture you belong to, or what country you are in. The overarching goal of IDDSI is safety. This is the IDDSI framework. It consists of a continuum of 8 levels to describe food texture and drink thickness. Drinks are measured from levels 0 to 4 and foods from levels 3 to 7, with crossover for levels 3 and 4. The IDDSI framework includes descriptors, testing methods. For information on IDDSI, please look at the IDDSI website www.iddsi.org. There you will find lots of resources and information. If you have an iPhone, there is an IDDSI app you can download from the Apple Store. If you have an Android phone, you can download this from Google Play. Let's consider the levels for texture modified diets. Level 7 is a regular diet. This means normal everyday foods of any texture and mixed consistency. Food may be hard and crunchy or naturally soft. This includes sandwiches. An ability to bite off food is required, and chewing ability is required for hard and soft food. Level 6 is a soft and bite-sized diet. Food must be very soft, tender and moist with no separate liquids. Bite-sized pieces, for an adult, this is 1.5 centimetres, which is approximately thumbnail size. Biting is not required, but it needs chewing before being swallowed. Food can be easily mashed or broken down with a fork or spoon. It can be eaten with a fork or spoon. A knife is not required to cut food, but can be used to help load the fork or spoon with food. No bread is allowed unless agreed by your speech and language therapist. Level 5 is minced and moist. Food is minced and moist and can be scooped or shaped on a plate. No separate thin liquid. Small lumps should be visible within the food and should fit between prongs of a fork. Lumps are easy to squash with the tongue. It can be eaten with a fork or a spoon. No bread allowed. Level 4 is pureed food. Food is of a smooth texture with no lumps and not sticky. It can be piped, layered or moulded as it retains its shape. Liquid must not separate from solid. It does not require chewing and is usually eaten with a spoon. It cannot be drunk from a cup or sucked through a straw. Most foods can be pureed in a blender using a little extra gravy or sauce. You may have to sieve blended foods to remove any bits. Level 3 is liquidized. This is a smooth texture with no bits. By bits, we mean lumps, fibres, bits of shell or skins, husks, or particles of gristle and bone. It can't be piped, layered or moulded on a plate as it won't hold its shape. No chewing is required. It can be swallowed directly. It can be eaten with a spoon or drunk from a cup. It cannot be eaten with a fork as it drips through the fork prongs. Effort would be required to suck through a straw. Again, you should always check with your speech and language therapist if a straw is to be recommended. Let's now talk about thickened fluids. Nutilus Clear is the thickener that is recommended and used within NHS Ayrshire and Arran. Your speech and language therapist will request a prescription for Nutilus Clear from your GP. It's suitable for thickening hot and cold drinks and for thickening pureed foods. Use only the scoop provided in the packaging. It's also important to thicken all drinks following the guidelines you have been given by your speech and language therapist. Level 1 fluids are slightly thick. They require 1 level scoop of Nutilus Clear in a 200 ml drink. They can be drunk from a cup and can be drunk from a straw. Your speech and language therapist will advise if it is appropriate to use a straw. Level 2 fluids are mildly thick. They require 2 level scoops of Nutilus Clear in a 200 ml drink. They can be drunk from a cup. Effort would be required to drink through a straw. Your speech and language therapist will advise if it is appropriate to use a straw. Level 3 fluids are moderately thick. They require 3 scoops of Nutilus Clear in a 200 ml drink. They can be drunk from a cup. More effort is required to suck through a straw. Your speech and language therapist will advise if a straw is appropriate. Level 4 fluids are extremely thick. They require 7 level scoops of Nutilus Clear in a 200 ml drink. Level 4 fluids need to be taken from a spoon as they can't be drunk from a cup or sucked from a straw. When your speech and language therapist recommends a texture modified diet and/or thickened fluids, you will be provided with a dysphagia care plan and advice and guidance leaflets for the recommended level of diet and/or fluids. There are now some good online training resources for health and social care professionals working with people who have swallowing difficulties. We would recommend Health Education England's Dysphagia Guide, a learning resource designed to support knowledge and understanding of the management of dysphagia. The Royal College of Speech and Language Therapists have identified the Dysphagia Guide as a resource that can be used to support people working in care to gain the relevant level of competency for the role as laid out in the Eating, Drinking and Swallowing Competency Framework. We would also suggest looking at online training provided by Nutricia. Nutricia are the company who produce the thickening agent Nutilus Clear, which we use in NHS Ayrshire and Arran. They have an online training resource called Learning the Fundamentals of Dysphagia using Nutilus Clear. We would recommend this for health and social care professionals, but also for carers. Finally, if you're concerned about difficulty swallowing, please refer to speech and language therapy. Also, If you are concerned about weight loss with someone who has a swallowing difficulty, please refer to dietetics. If you live in Ayrshire and Arran, a referral to the services above can be made by phoning the relevant hub on the numbers below. Thank you.